today we have Dr. Vishnu Priya, who is a consultant obstetrician and gynecologist at Aster Women and Children. And today we will be discussing about endometriosis. So doctor, can you just start with, what exactly is endometriosis?
So endometriosis is the presence of endometrial glands and stroma, means the lining of the uterus, which is usually is inside the uterus, is present on the outside the uterus. Normally those lining, the glands and stroma is seen on the ovaries, tubes and other organs. Where the women, how every month the endometrial lining grows and it sheds, the same way the endometrial gland and tissues which are there outside the uterus also, they bleed and the blood get collected in the particular areas. This is the endometriosis. So why is it so important? Why 2 to 10% of women between the reproductive age do experience this? Most of the times women do have a lot of symptoms like with pain during menstruation and excessive bleeding during menstruation, and they can have a pain during intercourse, difficulty in passage of stools during menstruation, and difficulty in passing urine during menstruation, or they can have hematuria also, depending on the location of the endometriosis.
So what causes this condition?
So exact cause for this endometriosis is not known.
Okay.
There are a lot of theories which would explain us why the endometriosis happened, but nothing is proven exactly what is the reason. They say it is retrograde menstruation, where the menstrual bleeding passes through the tube and gets deposited on the other organs inside the abdomen and cause endometriosis. This is one of the theories. Multiple theories, but nothing is proven.
So how frequently do people face this, or which group of people?
So it is normally seen between 25 to 40 years old, reproductive age group. And why is it so important is because it is very debilitating. Women do suffer a lot during their menstruation. It's a severe pain, and they do face this infertility issues because of this endometriosis. And why there is infertility issue is because of endometriosis, whatever the blood which is getting collected outside the uterus causes distortion of the fallopian tubes, distortion of the ovarian tissue, and there is a functional loss of the tubes in the ovary. So there will be an infertility issue because of this endometriosis, and the pain is the main thing. And there are different ways to treat it. So most common things is medications and surgical way. Depending on the symptoms and what they are looking for, the treatment would be like painkillers and hormonal therapies. If the person has completed the family and looking for the pain relief, then patient has to undergo minimally invasive surgery where the uterus and complete ovaries and tubes are removed, which are diseased.
What should one, be concerned about the most in this condition?
Endometriosis turning to any cancer is not there. Mainly the patient will have a lot of symptoms like have pain during menstruation. And one more thing is the progressiveness of the pain increases. Every menstruation the pain starts increasing as the blood gets collected in the tummy outside the uterus. So every menstrual cycle the pain will be increasing.
Okay. So it's progressive in nature.
Yes, the disease is progressive in nature.
I think that answers most of our questions about endometriosis. Thank you so much, doctor, for having this conversation with us.
Thank you.